It is a basic fact that as we get older, our skin gets thinner. Unfortunately, it's most noticeable in the areas we don't want it to show, and one of the most common trouble spots is around our eyes, where we see things like a droopy brow, so-called crow's feet in the corners. Well, now there is good news. There's a way to reverse these signs of aging in one treatment and no surgery. Dr. Ann-Therese Stubbs of Ann-Therese Aesthetic Medicine is here to show us how it works. Hi, Dr. Ann, nice to see you.
Nice to see you.
Why does physiologically skin start to thin, especially around those certain areas of the face?
Well, what happens as we age is the muscles get a little bit stronger, so we've been smiling and exercising those muscles around the eyes for years, so we get the crow's feet just because those muscles move over and over again. And then physiologically, the eyebrow tends to come downward as we age, and we all get a little bit of hooding. It's just the upper lid kind of comes down a little bit and makes our eyes look a little bit droopier, and that is inevitable, tragically, in everybody as we age.
Gravity does its thing.
We all look for lasers and different heating elements and different things to kind of address this issue, and today we're going to talk about Thermage of the eyes.
Explain what Thermage is.
Well, Thermage is unipolar radiofrequency, which is just a big word for a way to bulk heat the skin. So lasers, ultrasound, radiofrequency, all are technologies that heat the skin up. So if we can bulk heat the skin, we can cause our own collagen to ramp up and make more cells, so tighten.
There's a little bit of the technology explainer there.
Yeah, this is slide number 1 there just shows the cooling. So we cool the skin first, and then number 2 shows the heat going in from the radiofrequency and kind of down deep in the skin. And the last slide 4 there shows that we cool the skin again. So that's how we prevent it from burning.
And we have some pictures, because to me, these are some of the most dramatic pictures I've seen of a change that can happen without surgery.
You can see this picture here on the first picture. There's a great deal of hooding on the upper eyelid. That's what we were just talking about. The lid comes down as we age, and then this picture was 3 months after the Thermage treatment of the eye. And
it just opens it right up.
Yeah, just it tightens that skin, and especially the crepey skin under the eye too, that a lot of women and men find causes them to look a little bit tired or a little bit haggard. We can do this right up to the lash line under the eye. This gal here, you can see, got a nice little eyebrow lift on the tail end of her eyebrow. Got a little bit of the tightening of the skin of her upper lid, and her eyebrow, the tail of the brow, kind of elevated as well. Makes her look a lot less tired.
Is there any kind of downtime with this? And does it take a lot of time before you see the results? You said 3 months.
Well, that's a very good question, because collagen does not build right away. So what we do is we put an opaque kind of contact lens in the eye itself. So we numb the eye up with a little drop. We put this little thin plastic protective contact lens in the eye, and then we are able to treat all right to the lash line up to the eyelid and the eyebrow, and then the lower lid as well. So it takes maybe an hour. You're maybe a little bit flushed or red thereafter. Certainly no peeling of the skin, nothing that would prevent you from going to work or even going out that evening. So all the lines right around the eye look plumped out and kind of invigorated right after the treatment, but the actual final result, like you're seeing in these pictures, about 3 months till you see that.
And then how long will that last? Because obviously you've heated up the skin and boosted collagen, so how long till that collagen breaks down again?
The time clock's always ticking, so what we do with this, and I tell my patients—
I love how you keep reminding us of that.
We do, it does. So we've turned back the clock for a little bit. So with good care, with sun avoidance and sunblock and good products that help you build your collagen, that result can last up to a year. We usually recommend people kind of get another one in the next year, and it's something that can fit easily into your day, an hour into a lunch hour, no downtime, no redness. You can put makeup right back on and go to work. So this is wonderful for busy gals too, and guys, just because not a lot of downtime, don't have to hide for a week, no black and blue marks, nothing of that nature.
And it's been around for a while, so I think that gives people maybe a little peace of mind of the safety of the practice.
Exactly. Thermage has been in play for 12 years in the aesthetic industry, and we use it on other areas of the body too. We do it for tightening jowls, we do knees, we do bellies, we do anything where the skin needs to kind of shrink and tighten a little bit. It's a wonderful technology.
If people want to come to talk to you, Dr. Ann, about whether this or any other procedure is good for them, you have consultations.
We do, because there's so much technology out there, and I think people are sometimes confused by it. They don't know if they're a good candidate or not. And so we just say, come on in for a consultation. We'll look at what bothers you and kind of lay out all the technologies that are out there and what might be best for you.
Well, thank you, Dr. Ann. As always, interesting stuff, new advances. I love it.
Thanks so much. Thanks for having me.